Hello, I'm Peter Sallis. I'm a patron of the Macular Society. Like 500,000 people in the UK, I have macular disease. I know what it's like to be told you have this condition, and this film will explain what macular disease is, why it occurs, what can be done to treat it medically, and what other help is available. And there is help out there. You are not alone.
I used to be a GP and worked in Wolverhampton for many years. I was diagnosed with bilateral dry age-related macular degeneration in 2005.
They took a look and they said, yes, your optician's right, you've got macular degeneration. Do you know anything about it? I said, no, I've never heard the name of it before.
They sort of told me that I'd got macular disease and I'd probably be completely blind in 5 years' time and there was nothing they could do.
To suddenly be told by the consultant that there was nothing could be done and you were just dropped with a year's appointment. But my wife was an absolute rock and she, typical Midlander, basically just wouldn't accept that nothing could be done. And we got in touch with the local rehabilitation officer. We discovered a local macular society group, which was excellent, and we got involved with that. And basically, by trial and error, we found out that there's a whole network of stuff out there.
No matter who you are, even if you're a doctor, a diagnosis of macular disease can be bewildering. Sometimes people leave an eye clinic thinking that they will go completely blind, or that there is no help for people with MD. Neither of those beliefs is true, as this film will show. But let's start at the beginning. What is macular disease? Here's Professor Simon Harding.
Most people, I think, know that the retina lines the back of the eye, and that's the light-sensitive tissue which converts light into the messages of sight which pass from the eye through to the brain. The macula is the central part of the retina, which is where fine vision is located, and that's the area that you use for reading, writing, watching television and recognizing people's faces. And so you can see that if the macula degenerates, all those parts of the vision that you take for granted, which are important for daily life, become affected. Age-related macular degeneration comes in two main types, the dry form and the wet form. In the dry form, the pigment cells under the retina die off, and this causes a slow, gradual reduction of vision, usually over many years. In wet macular degeneration, new vessels form. Those blood vessels leak fluid, bleed and scar. And that combination of fluid, bleeding and scarring takes away the central vision. That loss of central vision can occur quite rapidly, often over a few weeks, and usually affects both eyes, although one eye tends to be affected before the other. About 5% of people with dry macular degeneration go on to develop wet macular degeneration.
So what causes MD? And why is it that some people get it and others don't? We're gradually building up a picture of the causes and the risk factors. It is now clear that genes play an important part in macular disease. 2 genes in particular have been identified. People with a copy of both these genes from each parent have a 98% chance of developing MD. But there are other risk factors too. The older you are, the more likely you are to develop MD. Most people with macular disease are over 65. There's a strong link between smoking and MD. A poor diet may increase the risk of MD. High blood pressure and cardiovascular disease have been linked to MD, and so has high exposure to ultraviolet light. There are also genetic macular conditions affecting younger people. They're all very rare and are often just described as juvenile macular dystrophy. Sometimes they're given specific names, such as Stargardt's disease or Sorsby's fundus dystrophy. All forms of macular disease have similar symptoms. The first obvious symptom is usually blurred vision. This can happen very gradually, and if only one eye is affected, a person may not notice for some time. And colour vision can deteriorate too, and gradually the central vision is lost, so that eventually only the peripheral vision is intact. This is typical of dry macular degeneration. Some people can suddenly notice that their vision is distorted. Straight lines become bent or wavy, or there may be gaps in the vision. This is a sign of the development of wet macular degeneration and should be treated as an emergency. A person may already have dry macular degeneration and then develop the wet form in the same eye, or wet MD symptoms may be the first they notice. Some conditions affecting younger people are also wet forms of macular degeneration. So anyone with these symptoms should see an optician or an eye doctor as soon as possible, because there is now treatment for wet MD, but it needs to be given quickly if it is to be effective.
So in recent years, a number of treatments have started to become available for macular degeneration, but only at the moment for the wet or neovascular form. As yet, there is no treatment for the dry form of macular degeneration. One of the important things to understand, though, is that treatment for wet macular degeneration is only effective in the relatively early stages of the disease. And I'm afraid that if you have had wet macular degeneration for more than 12 months or so, none of the treatments that are currently available are effective.
This is why anyone noticing a sudden change in their vision should go to an optician. If wet macular degeneration is suspected, you should be referred immediately to a retinal specialist at a hospital. You should not be sent back to a GP. Family doctors are not trained to deal with macular disease. In the case of wet macular degeneration, fast treatment is vital. So referral to anyone other than a retinal specialist will cause delay. Even if you have had wet macular degeneration for a long time, it is still possible to have a new episode which might be treatable. So you should always be vigilant about monitoring your vision.